Our team has been working on Ethiopian project for the past like 2 years. So we looked at COVID. Uh, uh, Ethiopia has got its own unique characters. There is a massive social interaction. So we recognized that there is a need for having like a homegrown strategy to tackle this shock. Uh, we looked at various factors why a standard lockdown would not be applicable. There are like more than like 8.5 million people living in PSNP. There is a huge chunk of population in both in urban and secondary towns. Again, this if we implement this total lockdown, it will disrupt the total value chains. So the social cost of this lockdown by far exceeds just allowing a normal transaction. So lockdown was not practical. So with a partial lockdown, it will allow like the government to build the healthcare system to reduce the chance of infection, to prepare resource mobilization and the like. So we suggested some strategies like geospatial lockdown, monitoring markets with where agencies would interact, like rural urban population would interact, and also like boosting testing capabilities. Uh, During our like 2 years engagement, we identified like foreign exchange to be the binding constraint. And when you add COVID to this challenge, it would mean like having a meningitis for a person who is still suffering from like goiter. So the country was still suffering from like data accumulation. There is a limited physical space. So we suggested for like the international community to intervene in different forms. The first one being like debt forgiveness, and the other one is like foreign injections from IMF, World Bank, and other donor agencies. They used to have like a standard mechanism of supporting governments. Because COVID is extraordinary, it calls for like extraordinary arrangements to support the Ethiopian government. That's the key lessons that we provide for the government. Thank you.